One of the most important goals of healthcare is to reduce pain and discomfort. You can play an important role in helping your patients by understanding moderate sedation and analgesia. This program covers the goal of moderate sedation and analgesia, 6 common complications, 2 age-related considerations for pediatric and elderly patients, and 8 precautions for performing moderate sedation. The goal of moderate sedation is to reduce pain and anxiety while preserving the patient's protective reflexes. With moderate sedation, patients can respond to commands, although their speech may be slightly slurred. More importantly, they can maintain their airway and avoid aspirating. With deep sedation, patients become difficult to arouse. They may lose their airway and they may even aspirate. Sedation affects each patient differently. A dose that is okay for one patient might be too much or too little for another. There are at least 6 important complications that you need to watch for. One is oversedation. Too large of a dose or administering it too quickly may cause respiratory depression and possibly loss of the airway. Before using any sedative or analgesic, be sure you know the recommended doses, speed of action, duration of effects, and potential adverse effects. Undersedation causes the patient to experience more pain than necessary. That may trigger the fight or flight response. This increases heart rate, blood pressure, and physiological stress. Hypoxemia may result from oversedation or respiratory depression. Mild respiratory depression can initially occur without overt signs and quickly progress to an emergency situation. That's why you should always use a pulse oximeter during moderate sedation. Aspiration may also result from oversedation. Again, when the patients lose their protective reflexes, they may aspirate fluids into their airways. Cardiovascular complications encompass several problems. Hypotension is the most common. It may be due to the drug's effects or to hypovolemia caused by the patient's NPO status. When a patient exhibits agitation, recognize that it may have 3 different origins. One is pain from undersedation, or the patient may be having a paradoxical reaction to the sedative, becoming agitated rather than sedate. Agitation is also a symptom of hypoxemia. Since hypoxemia is potentially dangerous, it should be ruled out first.
I know. You want me to put it on your toe?
There are 2 age-related considerations for pediatric patients. They require smaller doses of medications because of their size. Second, they can more easily lose their airways. Children have relatively large tongues and compliant airways that can be easily obstructed. Elderly patients also have 2 age-related considerations. They often require smaller doses because of their size or metabolism. They often require less frequent redosing. These patients may have reduced liver and kidney function, so they do not easily eliminate the drugs from their bodies.
Hi, Mr. Fayok.
Precautions for moderate sedation should be taken before, during, and following the procedure.
Okay. Do you have any allergies that you know about?
No.
No. Okay.
Before the procedure, take a targeted physical and psychological history. This will include checking for a history of allergies or adverse reactions to drugs, especially sedatives and analgesics.
Do you smoke?
Smokers and overweight patients are especially vulnerable to hypoxemia.
Have you ever had any problems with your kidneys? No.
Renal or hepatic deficiencies may reduce the patient's ability to metabolize or clear the
You
medications.
haven't eaten anything?
Check on the
or-
patient's NPO status and assess a baseline level of consciousness.
I'm going to tell you a little bit about the procedure. We're going to put some
During the
monitors
interview,
on you.
prepare the
We'll be
patient for
watching
the
your
procedure.
heartbeat.
Patients who understand that they may still feel some discomfort will more easily tolerate the procedure and may require less medication.
Okay. Did you have chest?
Prepare all drugs and equipment for the procedure. Prepare and check your source of supplemental oxygen.
I'm going to put some nasal oxygen on you.
Monitoring equipment should include a pulse oximeter and a blood pressure monitor. Label all drugs and syringes with contents and concentrations. Be prepared for an emergency. Check the emergency supplies. This should include appropriate sized airways and a method of providing positive pressure ventilation. Set up and check suctioning equipment. Be sure you have the appropriate reversal agents on hand. Finally, check to make sure that any necessary backup emergency personnel are immediately available. During the procedure, slowly titrate an initial dose, then wait to gauge its effect. Remember, each patient is different. It's best to start low and go slow.
Starting to feel sleepy?
Carefully monitor the patient's level of consciousness. The patient should be able to respond meaningfully to verbal commands or physical stimulation.
Okay, how are you doing?
I'm okay.
Are you okay? Okay, I'm just going to check your blood pressure.
Monitor vital signs. The person responsible for monitoring should not have any other responsibilities that would interrupt continuous monitoring. Oxygen saturation should not decrease markedly. Watch for significant heart rate changes, arrhythmias, and blood pressure changes. If required, reversal agents are normally given in small amounts. The goal is to reverse some but not all of the effects of the drugs. Document according to your institution's procedures. This information could be important if the patient encounters complications.
Feeling like you're waking up a little
After the
more?
procedure, continue to monitor until the patient's level of consciousness and vital signs return to baseline or the criteria set by your policies.
Blood pressure again.
Here again are the precautions for performing moderate sedation. Take a targeted history. Prepare all drugs and equipment. Prepare for an emergency. During the procedure, slowly titrate the medications to the desired effect. Monitor the patient's level of consciousness. Monitor vital signs. Document during the procedure according to your policies. After the procedure, continue to monitor the patient until the release criteria are met. Policies on moderate sedation vary from institution to institution. Be sure you are familiar with them. If you are not confident of your ability to support a moderate sedation procedure, consult with the physician or your supervisor.